Our nurses are a huge part of our team. They're the most extraordinary nurses that I've ever worked with.
All of us are so lucky to be in this profession and to be in a position where we can help people in the toughest of times, and it's such a gift to be trained to do what we do.
My favorite part about being a nurse is meeting a family and watching parents or patients' faces change from a place of anxiety and uncertainty to a place of comfort and understanding.
The nurses at Columbia are just absolutely fantastic because they have the toughest job to deal with both the patient and to deal with the family.
Roz is someone that is like my mom's best friend. Whenever there's something that I feel is off, my mom gets on the phone, texts Roz.
She's so patient. She's always available to answer my questions.
The reason why I became a nurse is because I wanted to actually make a difference in people's lives. That's why I continue to do what I do.
The biggest thing I think I've learned was through the nursing staff here at Columbia. They taught us that, we need to be the biggest advocate for our kids.
When you find out your child has this diagnosis that's going to be life-changing, you research the doctor, you research the surgeon. You don't realize how important the nurses are.
We as the surgeons spend hours and hours and hours in the operating room fixing babies' hearts, repairing cardiac defects, and this would all be for nothing if there weren't nurses helping us in the operating room, number one, and then nurses in the ICU taking care of those patients.
There are times where our ICU nurses have to give up to 30 medications in a few-hour period and give them on time and make sure they're not missed. So really without them, the care of our patients really would just be absolutely impossible.
You're just surrounded by a tremendous amount of very bright people, and together with all of everybody's experience, we do some of the most difficult heart operations that are done around the world.
I like getting pushback from the nurses because you want nurses who are proactive. I don't want robot nurses. You want nurses who are thinking on their own feet and who are individual caretakers.
When you work with children, you are taking care of the family. So my role as a nurse practitioner is throughout the continuum of their care. We often tell the parents most of the information. If they call and they're anxious or just worried, we're there to really educate them and inform them. But we really want to focus on the child and empower them to understand their health as early as possible.
Just having the families happy and satisfied, or just trying to help them bond with their baby that they're so afraid of, and so afraid of even to take home.
That beginning of taking them home, it's all of that I learned from you.
And I have to say, I didn't even realize I made such an impact.
One nurse in particular stands out to me was Tamar, and it was with the latest procedure. Tyler had to sign his own forms, and he had to know what a parent had to go through, the releases, what the verbiage was, what the risks were. You couldn't shield him anymore. And the ability for her to translate that, it's tough.
I've had these amazing relationships with children that started when they were younger, and now I get cards from them talking about their graduation from high school and going to college and going to nursing school and becoming researchers and having a real life that they didn't think that they'd be able to have. It's just been an amazing experience for me to be able to think that I was part of that.
We take care of the sickest of the sick here at Columbia. Our nurses are taking care of those very, very sick patients and those very complex patients. Our program here at Columbia would not be what it is without our pediatric cardiac nurses. They're specialized, they're empathetic, they're compassionate, and they're the best around.